We begin this week's show with healthcare, and more specifically, the difficult process of attracting new doctors to the Strait Area, and once they're here, trying to figure out how to keep them here. Well, there's a new committee set up to do just that. It's called South Cape Breton Recruiting for Health. It's made up of the town of Port Hawkesbury, Richmond Municipal Council, the Cape Breton Partnership, the Strait Area Chamber of Commerce, and stakeholders from the local healthcare scene across our region, including the Strait Richmond Hospital in Evanston, St. Anne's Community and Nursing Care Centre in Arishat, and the Dr. Kingston Memorial Community Health Centre in Lordways. Together, they're hoping to bring new doctors to the area. And just recently, the committee reported some success when it welcomed 6 potential doctors that might be interested in relocating to Atlantic Canada once their training is finished. They spent some time in Port Hawkesbury just last weekend. Here is Town Councillor Trevor Boudreau, the chair of the South Cape Breton Recruiting for Health Committee, to tell us more.
So a lot of the physicians had young children, and they really wanted to see the schools. French immersion was a big thing for 5 of the 6 physicians, and so it was wonderful. We had the vice principal at Tamarack take us on a tour and talk a little bit about the program and the numbers of students in classes and what they have to offer. And then when we were at Sarek, the vice principal was there as well and was able to really give us a great tour of not only the school part of it, but really that's a community hub as well. So we have our auditorium, our pool, our library, all of those things are in there, and they were amazed that the community could use these things. It's not just the school thing. So then it became, well, I can go swimming, or I can go play basketball in the evenings on Wednesday night, so they were really impressed with that. We were able to see a few other things as to what was important, like being outdoors and hiking, and so we were able to provide them with things from Destination Cape Breton and showing them what Cape Breton has to offer as well, because what better place to live than Cape Breton Island?
All of our visiting physicians and their spouses were just in awe of the beauty of the waterfront. And despite the fact that it was winter, they still took probably several hundred pictures, and so they were really interested in that aspect of our town, because it's we have so much here in the town of Port Hawkesbury to offer, and it was a wonderful opportunity to show and demonstrate how great Port Hawkesbury is as a place to live, work, and play.
The 6 visitors to Port Hawkesbury earlier in March, 5 from Nigeria and the other from the Czech Republic, were here courtesy of Nova Scotia's Practice Ready Assessment Program, or PRAP. It's a program that ensures that international medical graduates who want to practice family medicine in Nova Scotia have the appropriate clinical skills and knowledge to provide quality patient care. Now, when asked whether municipal units like Port Hawkesbury should be doing the legwork in terms of showing off their communities to physicians, as opposed to the Nova Scotia Health Authority or the Provincial Department of Health, Councillor Boudreau suggested that this is truly a team effort, and it will take the efforts of both the municipal units themselves and the Provincial Department of Health to be able to show physicians just why they should move to places like Port Hawkesbury.
Rural Nova Scotia, rural Canada has a healthcare issue, and it's really hard on the provinces, and who better to represent your community than the people who live here and work here every day. And so is it a responsibility of the municipality? Not directly, but if we want economic development, we want people to move here, and we want our businesses to thrive, this is something that we need to do. So really it comes down to, we don't put the dollars and cents into healthcare, but I think, it's an eye-opener for me saying, we have to take our part and do it. And nobody's going to sell us better than we do.
And according to Port Hawkesbury's mayor, the hospitality shown to the visiting physicians is starting to pay off already, with a lot of enthusiasm going around social media and the World Wide Web in general for Port Hawkesbury's efforts.
We've already have upwards of 15,000 views and lots of positive comments with regard to having that opportunity to show 6 physicians around the town of Port Hawkesbury, and not only to benefit the town, but also to benefit the Strait region.
However, despite this recent success in courting local doctors to come to the Strait Area, a town councillor here in Port Hawkesbury isn't convinced that the Department of Health is being forthcoming in terms of information connected to a construction project that's happening just behind me. At this corner of Reeve Street, you'll find 2 physicians' offices, the offices of Public Health, Mental Health, and Addiction Services, and just behind me on the right, the Medicine Shop Pharmacy. They're all going to be in one refurbished building right here on Reef Street. However, Deputy Mayor Blaine Macquarie feels that the health department isn't giving enough updates in terms of this project, and he'd like to see more. So Mayor Brenda Chisholm-Beaton and Port Hawkesbury CAO Terry Doyle have pledged to contact the Department of Health to see if they can find out some answers on what's going on here and when we can expect it all to come together. On Reef Street for Telile 24/7, I'm Adam Cooke.